Today, Steve and I visited with Dr. Dom Schultz, who is a chiropractor here in Fort Wayne, Indiana. Dr. Dom is not a normal chiropractor. He uses a holistic approach when treating patients, meaning he combines adjustments, movement education, and exercises. In this video, Dr. Dom gives us a bit of insight into how he approaches treating a patient.
Of education of like, how do you assess a problem and where do you start? I'm kind of a big guy on like entry, like where's the entry point with this person, right? Because it's kind of, at the end of the day, everybody's got similar problems and you're just working towards like just getting stronger and moving better, right? And we all know that those are relatively basic movement patterns to get them there, right? Can they lunge? Can they do a step up? Can they squat, right? Can they hinge? So, I mean, as long as you're working everybody towards that spot, you're usually in a good spot, right? But you have to start at a different spot with different people depending on their biases, their injury history, their state of their nervous system, stuff like that. So, but I thought just kind of walking through just a little bit of like, what's actually happening, right? Because you're right. You get a ton of people that like, oh man, I'm out. Like, oh, this is out. This is out. It's like, no, there's nothing out, right?
Okay.
Like, it might not be moving well, and you can feel that as you're walking, right?
Yeah.
You can sometimes you are like the whole short leg, long leg thing. I'm definitely not a big believer in that. I mean, you can kind of see it sometimes, but I can go and brush somebody's glute and check again, and it's even, right? So like it's super transient, so I don't really ever check that. But sometimes you can feel if the hip's a little jam, you're like, man, I'm just not walking right. So there's some truth to, or just the sensation of feeling out, but nothing is out, right? Like it's just not really moving well. I think a lot of people kind of just forget that like within the joint itself, there's a crap ton of sensory fibers, right? So it's always constantly telling our brain and our body like where we're at in space, right? Like what we're feeling. So we're there, like that's just the anatomy of the joint. Obviously there's some sort of injury or dysfunction that brings them into me or a PT that they need some sort of help. That dysfunction leads to some sort of poor movement patterns, usually an increase of kind of sympathetic tone where there's just tightness, pain, hypersensitivity. So that's where they're looking to get some relief. And then the adjustment really is just like a quick burst of input, right? A quick burst of sensory input. And there's actually a nice paper in 2024 that kind of looked at like functional MRI and EEG readings pre and post adjustment, and saw that like the brain really like reorganizes where it's at and kind of a lot of different activity through the motor cortex, limbic system, prefrontal. Like there's a lot of reorganization that happens directly. More specifically after a neck adjustment, cervical adjustment is where you get a little bit more of that. So it's it can free things up, and you usually do, right? That's where people kind of come in because they feel stuck, and that little impulse kind of, again, just creates a little bit of safety, if you will. So we get a quick reduction of that sympathetic tone. So that's where some of that like range of motion comes back from. But
when there's a pop, what happens? What just happened?
Yeah, we're not fully like 1,000% sure.
Cool.
There's some uncertainty there, but it's usually kind of just portrayed as like a release of air and fluid that's in the joint, and it reforms really quickly, right? You got a synovial fluid that's in that joint, a little bit of air too. I move it quickly, that kind of releases and reforms, and that's the audible. So that's it's not joints kind of like reshifting on top of each other, like bone on bone that's moving. No, it's like synovial fluid that kind of releases and reforms.
So when I twist my knee, it cracks. I don't want it to. It just happens, but there's no pain. Any concerns, just in general?
Yeah, that's a great question. I get that a lot, right? Majority of the time, I'm talking somebody down from that. Like if it's painless, and that joint doesn't really have some sort of large dysfunction to it. It's usually just maybe a little bit of excess swelling that shouldn't be there, right? From some sort of like repetitive motion that might not be the cleanest, but again, if there's no sharp pain associated with that, no sort of collapse, no major problems within that, on that side of the body in that chain, I usually kind of talk somebody out of that. Yes, we can get it to go away, usually with certain sort of, stability drills, or honestly just really simple. Like I have a patient that had really cracky knees, poppy knees all the time, and put her on a leg extension machine and just freaking crush the quads, and then paired that with a seated leg curl, crush the hammies, and like knee felt open, knee felt good, no more popping, and it's kind of gone away, right? So it's, yeah, I don't really read too much into the painless little, cracks.
Okay.
Yeah.
So an adjustment
Yep.
helps create awareness to that area.
For sure.
And you mentioned, maybe you talked about it and I just didn't absorb it.
Yeah.
Why does it feel like stuff opens up with that? Is it because of that awareness?
Yeah, it's pretty
Okay.
much just a big increase of sensory information, right? And that just creates more information for the brain to kind of just feel good about what's going on in that region, and we'll get just that acute and relatively, transient effect, right? Like we know that the effects of the adjustment are pretty temporary, right? Like, maybe sometimes you can hold on to that for a couple weeks if you're lucky, right?
Yeah.
It feels perfectly timed, perfectly executed, like you were primed for the adjustment. Like, you can feel really good for 2 to 3 weeks. Other people are like, man, that kind of came back within hours, days, right? It could be that. So you have to really pair it with some sort of movement that then supports, what that person needs, right? Is it just more blood flow? Is it a little bit of, some sort of isometric? Is it just a classic stretch, right? And then after the adjustment, it's like, let's educate you on some movement hygiene to try to stop this from recurring, right? Like what's going on in your day-to-day that's leading to this sort of compensation or overload. But yeah, I think that's where my beef maybe with the chiro community is that we don't do enough of the second two. We don't do enough of the pairing of the exercises with the adjustment. We don't educate on like, hey, how not to have this happen again.
Yeah.
Right? Like and I say it in the room almost every day, like, hey, I want you to see me less, man. Like I don't want you to be in here. Like I love you, love talking to you, love working with you. You're like, I have a good relationship with my patients, but if you're in here, like there's something wrong, and that's that's something in your day-to-day that needs to be cleaned up, and then let's talk about that.
Yeah. Okay. Yeah. My girl goes to she'll have like a neck pain and back pain. She's got a chiro. I don't know his name, or else I'd call him out. But it's like, oh yeah, I go 15 minutes, crack, and that's it. I'm like, I don't think you're getting what you think you're getting.
Sure.
Unfortunately.
Yeah, and I can't say that I've never just adjusted somebody and like tell them to see them later, right?
Yeah.
Like, some people, that's just what they want, right? Like they've tied some sort of positive benefit to this. I'm used to this.
Yeah.
I grew up doing this. I just need an adjustment.
Yeah.
That's all I want, right? And sometimes I don't want to do rehab. I don't want to do anything you say. I don't care. Just crack me and let me go, right? So that's where you're just assessing somebody's, and just delivering on what they want. But for the majority of people, especially people that seem to be attracted to this place, we get into a lot of the movement stuff.
Yeah. Good for you.
Break down movement hygiene. I don't think I've ever heard that before. What do you mean by that? Kind of like what's the idea behind that?
Yeah, sure. I mean, I think like there's always tons of different strategies to get things done, right? Everybody's body's so different, but there definitely are things that are a bit more optimal to getting that done safely, recruiting as much as we possibly can without overloading certain tissues that shouldn't be handling that load repeatedly. So movement hygiene. Let's like one example. Let's say somebody goes down to grab something or tie their shoe, right? So I'm in that kind of positive shin angle, and I grab this thing, like, all right, most people is just like pop right back, right? Early extension of the knee, load the low back all the way, and that's where you can get some proximal hamstring issues, or like you tear the low back, right? So movement hygiene is teaching them how to kind of delay that knee extension and allow the hip to do the work, right?
Okay.
So it's like tons of ways to get that done. Which one's more optimal, which one can save you, which one can recruit the most, just powerful muscles that are supposed to do that. So that's a really simple one, but that's actually a big one that a lot of people screw up, is that early knee extension just, really tears up the low back.
Yeah. Yeah, I even see it with like older family members standing up.
Sure.
Like instead of just being able to,
Right.
it's like,
Do it right away. Right. Yeah. Like, oh, your low back hurts. Yeah. Like you're using it over and over again. Like where's the posterior chain at, man? Where's the glutes at? So yeah, that's kind of what I mean by movement hygiene, is like really simple movement patterns that they do going up and down stairs, getting up from a chair. Educating them on how their current pattern is not serving them. So
okay.